Hi, I'm Mara Antonoff, and I'm here at AATS 2024 in Toronto with Dr. Cecilia Pompili, who is really a world expert on patient-reported outcomes and quality of life after surgery, including lung cancer surgery. And I'm really interested to talk with her today about the results that were reported by Dr. Jonathan Spicer related to the CheckMate 816 trial. We know he reported on 3-year outcomes related to health-related quality of life for patients that were involved in CheckMate 816, and you provided some excellent commentary regarding this paper. I'm wondering if you can tell us first a little bit about what his results were related to
thank you so much for this opportunity, because I think really this is the first time that we can see 3 years follow-up from the patient perspective after, of course, these amazing clinical results of CheckMate 816. So it showed that essentially there's no difference between the two arms from the patient perspective up to 3 years. And the other important results is also that, of course, these differences are not important when we are looking at the high-risk groups in terms of quality of life deterioration. So it's confirming that, of course, having neoadjuvant therapy is not affecting patient-reported pain or generic quality of life. So really important.
It seems as though for many of our trials that we have in recent years that are really changing the way that we treat resectable lung cancer, we don't have so many results in this area of quality of life. Do you think that's something that's going to get better, something that's going to be implemented more frequently?
I think so, because we've seen from other trials that some of these results are coming up. Of course, not so long term as CheckMate 816 has done like yesterday, but definitely some patient perspective are more integrated into this trial. So, and it is a very important information that we need to inform these patients, the future patients, before proceeding with neoadjuvant or perioperative therapies.
What do you think about the metrics that we're using? Are these scales for judging quality of life, are they the right scales? Should we be using something different? What do you think about that?
So definitely, this is the most important way to collect information that we can use afterwards. So far, most of these trials were including only generic questionnaires, so it would be nice to have more, of course, lung cancer specific, and definitely some question about the post-surgical symptoms.
Sure.
So a little bit more specific questionnaire will be useful to dig into the patient-reported outcomes more. Some of the trials are using lung cancer specific, so I'm really looking forward to know the results of these trials for sure.
We obviously know there are a lot of strengths to the CheckMate 816 study and all the results that were presented by Dr. Spicer. Do you think there are some limitations to what he presented for us yesterday?
Yeah, definitely, of course. We are reporting quality of life only of the alive patient, so this is an intrinsic, of course, limitation of all the quality of life.
Right.
So we don't have also more perisurgical details, because that was as the trial was defined. So it will be, again, very interesting to know more closer to surgery, the return to the baselines, because that was the main results. How will be, again, in the future, looking at quality of life immediately after surgery and not only more farther down.
Sure. And so these were the 3-year follow-up. I think we can all jokingly laugh about the fact that every major conference we have, Dr. Spicer or his colleagues have the opportunity to present some additional result from the CheckMate 816 trial. Do you think that these quality of life metrics should be continued out further, 4 years, 5 years, 10 years, or do you think that we've kind of hit the final result that we're going to see? And
I think what he presented is the most important thing. So we know now that the time to deterioration, which is a common metric in PRO's methodology, it's not, so it's the same in the two arms. So having a neoadjuvant immunotherapy is not affecting this. I think that having 3 years follow-up is already, let's say, a main outcome, definitely. Sure. So I will probably focus more on assessing in a granular way what's happening more before and after surgery. But yeah.
Do you think there are any other patient perspectives or patient reported outcomes that we should be incorporating into these major trials that we really aren't doing yet?
Yeah, again, like I said, probably these more lung cancer specific
Sure.
symptoms and also immunotherapy related symptoms. So it's not only adverse events that we need to collect, we definitely need more patient's perspective. So for sure, the emotional burden that the patient has during this immunotherapy or perioperative therapy is important. The social and again, more physical functioning. These are also very important because these are all information that we can use for future patients to inform them and to convince them that having neoadjuvant immunotherapy is not affecting their quality of life.
And I suppose as we continue to follow these patients out further and patients do develop recurrence, understanding the patterns of recurrence will also impact their quality of life because, for example, we know that intracranial metastases result in a different quality of life outcome than someone who perhaps has regional recurrence or maybe an adrenal or bony metastasis, and that all of those elements, what type of therapy do they need for their recurrence, can impact the burden on their family and their symptoms and their everyday life as well.
Absolutely, and this is the reason why, for example, in terms of we call role functioning and social functioning, how do they relate during these therapies with their family or with their work life. So we have younger patients that are, of course, deciding whether to go for one therapy or the other one, because how will be their return to the their original quality of life and social life. So we definitely need these. So, and of course, the pattern of recurrence and the further treatment are affecting their quality of life, so definitely needed.
Terrific. Well, this is such a great discussion. Are there any take-home points or closing remarks that you want to share with our audience?
I think, again, it was great to see for the first time long-term patient-reported outcomes from this important trial. So we have eventually some PROs that are coming together and are confirming, of course, the safety from patient perspective of this landmark trial. So.
Terrific. Well, thank you so much for your time.
Thank you.